Welcome back to Northwest Digital News. I'm Kevin Hunter, Chris Bornstead, and Kyle Torgerson is actually off screen today. But we have Dian Cooper and Jim Coffey with us from Family Health Center. We're going to get into a little conversation about some of the background with what took place with the needle exchange program and how it came into the care and guidance of Family Health Center, and then get into where it's at today. But before we do that, Kyle, hit us up with what's going on in the weather.
I have a mic.
Oh, here. By all means, Kyle, here. Use mine.
There you go. By all means, Kyle.
Hey, guys. Today is going to be a high of 41 with a low of 32. It is partly snowy, partly raining, depending on where you are. I guess Castle Rock got a pretty good snowstorm this.
Yes, it did.
Yeah. So this week it's going to average around 50 degrees high with a low of about 28. But check that out. Sun.
We got a lot of sunny globes. Chris is going to be pulling out the swimming pool.
The pool's already up. We just didn't take it down this year.
Inflating the floating mattresses. He's going to be out there.
I am not filling it with rainwater, just so you guys know.
Just so anybody knows.
Pool party at Chris's, right?
Yes.
We've had a few.
All right, Kyle, get the weather off the screen. We're done talking about weather for the moment. We'll come back to sharing, those of you who have been following the show for some time, we'll come back and share with you how to get some tires here in just a moment. But before we do all of that, let's talk about Family Health Center. We have Dian Cooper and Jim Coffey. First of all, welcome to Northwest Digital News.
Thank you.
Thank you.
Coming in.
Glad to have you guys here. So let's go back, and Chris, you can feel free to interject in here a little bit too, but this was a program that was being run by the county, and there was a fair amount of both for and against in the community with all of this, but what was really the county's primary beef, or the citizens' primary beef, with where things were sitting back before you guys took over this program?
So, my opinion...
We could start, too, by, and let's tell the viewers that I was one of the most harshest critics on the needle exchange program out there. I was one of the people that was in the fight on this, on the opposite side of Diane. So one of the complaints is that, and it wasn't just you guys, but there was a shelter in Kelso that brought a lot of people in, and so we were finding needles just everywhere. Mm-hmm. And we were really frustrated because the shelter was only about 2.5 blocks away from the needle exchange program. And it seemed like the needles just couldn't make it to the exchange for some reason. Mm-hmm. So that was one of the big complaints is that we were seeing a lot of needles in the communities, in the parks, in the spray parks and stuff like that. And so we wanted to get that, try to fix that.
The chief needle picker-upper, Jeff Wilson, might actually be out there today.
Yeah. You know, we had tried to work with the health department, but they just weren't very user-friendly with us. They had the attitude that, you know, we're the government, we're right, we're going to do what we want, and now we have somebody that we can actually talk with and work with and express concerns with. So
Diane, I remember the meeting where you put your hand up and said, hey, I'll take over that.
Yeah.
Did you feel like you were stepping out into this black hole that could maybe end badly?
Right over the cliff, yeah.
Yes.
But Family Health Center, our origins really are very community-based, mm-hmm. and very much about prevention. And needle exchange programs, when they started, really were all about preventing diseases, HIV, mm-hmm. Hep C, and also trying to hook folks with a lot of barriers. I mean, addicts have a lot of barriers. Mm-hmm. In with resources and get them help with their addiction. As the money kind of went down countywide, with the county over the years, they cut back and cut back and cut back on their staff and mm-hmm. how many services and supports that they could offer. And at some point, and this was several county commissioner groups back,
right,
before the current one, the county commissioners and the director of the health department at that time, Carlos Carrion, mm-hmm. Came to an agreement that they just weren't going to be providing much information to the public. And so all of a sudden we had this program that had been around for years, been reporting regularly to the commissioners, and dead silence. And at the same time as a lot more needles in the community, and the county was operating the program out of one of our facilities.
Yeah, yeah. And that was a lot of confusion too, because a lot of people were like, well, you guys are just turning it over to the same entity that was running it. Well, there's a huge difference when you have somebody above you that is running a program out of your building that is holding the purse strings and making all the rules. And so you guys get to do that role now. You guys get to run everything and be in control of everything in your facility without having to answer to the health department. You guys have to answer maybe to the commissioners now, but you've cut like almost another person out of the scenario, which makes it easier for you guys. You don't have somebody micromanaging you.
And we are governed, Family Health Center, by a community-based board of directors, and over half of our board are actually consumers of our primary care services. So we have a very unique board set up. It's not elected officials, but it's people that actually have skin in the game with our services.
So now one of the questions that I have is when I think about how the needle exchange program was being administered back before you guys took over this, and even if it was in your own building, I'm curious what has changed as far as the level of expertise, because we're going to get into the results here, but there's been a very significant improvement in the program. And I think about, if I was administering the needle exchange program out of your building, but doing it based on my expertise in drug addiction, which I know nothing about, I probably could have handled it just as poorly as the county was, because it would have had no clue what the options were for any of the addicts who might be coming in. If the program said, give X number of needles for X number who come back, I might have just said, well, here you go, and whatever. And was that really kind of what's happening? Did they not know what the next step was for these people coming in?
They had rotating staff there, so different staff. Depending on the staff, they were more or less informed and more or less supportive of the program and wanting to even interact at all with the folks coming in for services. Our staff is consistent. We have the same people there every week.
That's good, so they can see those faces and they know.
And the majority of our staff actually are in recovery themselves, have gone through treatment, have turned their lives around, so they know what it's like to be in the situation.
Oh, exactly.
And they know what it's like to be on the other side and what it takes to get from one place to the other.
Very significant.
And do the people coming in, do they know that these people that are working there have gone through the same things? Because that makes a big difference too, because it's easier to talk to somebody like that than let's say I don't know you and I'm coming in and I'm doing illegal activities and I'm going to come in and I'm going to ask you to help me with that, and I don't know you very well, so I mean.
So I can answer this question. So I'm there pretty much every time the program is open. These days I'm not there the entire day of the program. I am not somebody who walked that road. I have family members who have gone down that road, but I have been called out numerous times by the users of the program who say, so you're not one of us, because apparently it's pretty obvious to them that I'm not somebody who's walked that road.
Well, I found out that it's not obvious and that anybody can fix themselves.
Well, my staff are really open about where they are in their lives. And so they make it known to the staff, to the clients that come through, that, we've been there, we're here to help you. We want to help you get into recovery and turn your lives around.
So Jim, are you basically the one with Family Health Center that's administering this program? Are you the one who oversees it, or who does?
Basically,
yes.
Yeah.
Okay.
I help out. I'm Jim's backup.
Okay.
So when I'm not around, she'll pop in.
So now here's something else in my brain that lets me know that this is a much better program under you guys, is that you're the boss at the Family Health Center.
Yeah.
And you got your hands in the middle of it. The person that's running the health department, they weren't involved. So,
right,
again,
yeah.
Thank you.
Well, and so here's the other thing that we did. I have to give props to our staff. So when this was all just a big mess in the public eye, we sat down with our staff and our SUD programs and said, look, you guys have walked the road. You tell us how many needles is reasonable. How aggressive is it reasonable to be about asking if people are ready to go into treatment? What additional services should be there to help these people out? And this group of our staff, they not only just lined it out and said, look, you know, I was a heavy user and this is the most needles I ever used in a week.
I could see
you
that.
know, they also, as a group, went to our board of directors meeting, asked for to be put on the agenda to speak to our board about how important it was to them that we not only do this program, but we do it right and we get more people into treatment.
So with having somebody having input into this who was a very heavy user, you now have a bar of this probably ought to be the maximum number of needles we give. And by giving out a weekly amount, you actually get to see that person every single week, and maybe with the other treatment programs you have and stuff like that, the possibility of introducing them into corrective action is that much better.
Yes.
So I don't know if you guys know much about the whole public health campaign to reduce tobacco use in this country.
Not really, no.
But the best practice for reducing tobacco use is every time you see your medical provider, you're asked if you smoke. And if you say yes, you're asked if you're ready to consider quitting. And if you say yes, then you're offered the resources. And that's the practice that we have put in place over there at the harm reduction program. These folks, and that's the only complaint I've ever gotten directly from any of the users of the program. Can you just quit asking us 3 and 4 times, are we ready to consider treatment?
Well, this isn't the candy store.
But you know, it's like with anything else. You know, are you ready to consider losing weight? Are you ready to consider changing any behavior?
Yeah.
If nobody ever asks you and gives you the opportunity, you may not ever think about that.
No, I think that's great. I think that's great. Chris?
One of the things we learned about 6 months in was that people were actually dealing on our property. And so we took action on that straight away. We put up signs within the building and said that if you are caught dealing on our property, we will have you arrested, because that's not what we're there for. So, and we walk our parking lot and the area that the users sort of congregate in while they're there to make sure that they're not dealing on our property.
You guys can pretty much see your property from every angle, you know, from the road, and then you guys are right there next to the fire department, so you got some security there too as well. But you know, the drug dealing is just going on everywhere. I see it in the social media. You know, people at the grocery store are doing it in the parking lots, and you know, so that's good that you guys have done that.
Do you think that was happening before, Jim? I wouldn't have thought of the fact that the dealers might go, well, here's a needle distribution place.
I didn't even think
good
about
place
that
to hang out.
It could have been. I didn't spend much time there. I've only been with Family Health Center about 3.5 years. And so when when I got here and started getting involved in the needle exchange program, there were a lot of people that just sort of hung out. But the program, when it was being run by the county, was a lot less welcoming. So people sort of slipped through pretty quickly, although they would, on a number of occasions, stop and shoot up on their way out in the parking lot. And we did find that out because we ended up catching a few people, and it was like, you can't do that here. You know, go around the corner, go someplace else, don't do it on our property.
So you brought a bunch of slides and reports here today, and this compares back from when you guys took the program over, and the data is current as of when?
So this data is from the calendar year of 2018.
Gotcha.
So it's our first full year of operation.
First full year.
I'll show some of this data on the back screen, and then you guys can comment on this as far as what our viewers are seeing.
I did want to actually interject one other thing.
Sure.
You know, while it was kind of a pain to have all the opposition, and man, you all came out and talked to me. I'm glad you did. We also reached out to the sheriff's department and Kelso Police. We really were intent to make sure that we were building this so that we were within acceptable community standards.
Well,
one of the things I want to mention, because you, before the show, you mentioned that you took the time to go out with Jeff Wilson, who was finding a lot of these needles in various areas, and you took the time to go out and see where these were being deposited. Have you done any follow-ups on that to see, like, what the, here a year later or a year plus later, to see what level of needles might still being found in public?
Well, Jeff talks to me every once in a while, so does Chris. They're not finding needles. The Foot Patrol is not finding needles when they're going out. We have our staff out there every Friday morning, and they rotate around the community at kind of high-risk places. They're not finding needles. Now, the drug court clients are doing a community service project tomorrow where they're cleaning up the debris from the abandoned homeless camp down at Gearhart Island. Yeah. I've heard reports that the abandoned vehicles in that area might have quite a number of needles. The drug court clients reached out to us, asked for sharps containers. They're picking those up today. We're giving them our slideshow on how to safely pick up.
Oh, you guys have a slideshow. Is that on your website by any chance?
No, but it could be.
Yeah, that should be on your guys' website, because that's information.
We're also loaning them puncture-resistant gloves and tongs to do the pickup with. And on the promise that they have to return the sharps containers to us for appropriate disposal.
You got it.
Yeah, I've not seen needles like I did in Kelso. There for a time, I couldn't even go to Safeway without seeing them in the bushes, and that has stopped. I mean, I don't. Maybe every once in a while I'll see a cap, and that's about it. But I have not seen it, and I'm still out there, talking to people and stuff like that. And I'm not seeing it in town. So, and that was what we wanted, was to get them off the streets and into where they're supposed to go.
Right. I see Jeff has a comment, and I did misspeak. I'm sure everybody is still finding syringes. We actually also have been very forthcoming and aggressive in our communication with the folks coming to the harm reduction program that they need to police their own.
Yeah, I'm glad that you do that, because and some of them will, some of them won't. Now, one of the things that we found out when you go out and do cleanup is that you have to be very careful with anything that you pick up, because they do kind of police themselves in a way to where they'll put, at least some of them, put their needles in a container, and then they'll wrap them up in their belongings so that if they're going through town, the police won't see them and be like, get cranky with them. So you got to be really careful when you're picking up and throwing away garbage, because they could be anywhere. But we do have comments here, and Jeff is just saying that we still find them, just not as bad. I mean, I haven't found one in a long time. So
there's also a comment from Christy Ellis. She says there's an article in the TDN saying FHC is treating persons in Rainier, Oregon. She says it's out of county, but also out of state. What are your thoughts on that?
Well, Family Health Center, every federally qualified health center has a geographic area that they serve. Family Health Center's area that we serve does include Rainier, Clatskanie, Deer Island.
And all the way out to the Pacific Ocean.
Yeah.
Gotcha.
So to the extent that we have folks coming in for our other services from Oregon, we also have those folks, not those same folks necessarily, but folks from Oregon coming across the river to our program.
Let's talk about the data that we're seeing on the back screen. So these are the stats from 2018, your first full year running the program. One of the things that I see up there, notable, is the number of syringes received exceed the ones dispensed. That's excellent.
That means you're taking in more than you're giving out.
Yep.
Right.
That's not something that I think it was the other way around when the county was in charge, or close, or I can't remember the numbers.
Number I'm really proud of is this one. Let me see if I can get there. Oh, my hand's away. Anyway, the syringes dispensed. So for 2018, we gave out just a little under 400,000 syringes,
Mm-hmm.
which is between 400,000 and 500,000 syringes less than the county gave out in their last full year.
Wow.
So the numbers are going down. Now I know that one of the things
Yeah,
that
that's less than half.
one of the now and things that was making these numbers higher, and this is just because I've lived here my whole life. I have friends that are in the that have drug issues. I know a lot of people. But one of the other things that was going down that was bumping these numbers up is that you had dealers from Vancouver area coming up here and sending people up here to get needles to hand out with the drugs that they're selling to their clients.
Mm-hmm.
And I'm not hearing of stuff like that going on as much anymore, and I don't know if you guys have ever caught anybody doing that. But that is something
Yeah.
that happens at all the needle exchanges around the country, not just with you. It's just we get preyed upon a lot from people from Portland and Vancouver because we're so close. But I'm not seeing that anymore as much
Yeah.
either. So
I haven't heard of, the dealers, coming up, they'd rent the motel rooms, they'd do the shooting gallery stuff. I haven't heard about that a lot recently, but I have no idea whether it's going on still or not.
yeah, I know that we're using like Motel 6. I mean the police and the guys that monitor the guys in jail. I can't think of them now. Probation officers. They were constantly at the hotel, and we're starting to see less of that as well too. So I mean, it sounds like we are turning some things around, and that's good. Now,
I'm curious to know if you guys have had an opportunity to visit any of the other needle exchange programs that may be run by counties, but anywhere else in the state.
Yes. Actually, I went down and visited Clark County about 4 or 5 months ago, and they have what's called a needs-based program, where you essentially the user can walk in and say, "I'd like 500 syringes." Walk in with empty hands and walk out with 500 syringes.
That's what they have.
That's what they have.
I
So
think
it's called a needs-based program, and in talking to the state and a lot of the other syringe services programs, we're one of the unique ones that has a very limited number of syringes that we give out. A lot of them are needs-based, and sort of in a perfect world, if everybody went through a needle exchange program and got for themselves, the numbers would be pretty small. But a lot of people go and exchange or do a secondary exchange for people. When we were down there, we actually saw a woman walk in with basically one of those huge trash cans you would put out or buy at Home Depot that was full of syringes, and wanted the same amount to go back out with her,
No
which
way.
was around probably somewhere between 5,000 and 10,000 syringes.
Oh my gosh.
For most people, like my niece is a type 1 diabetic, and she injects, I don't know, 4 or 5 times a day. She's using one of those pens now, but when she was having to draw it all up and do the science experiment, she was probably going through 5 or 6 syringes a day. That would have been like 10 lifetimes worth for one person. So, and when we talked about the numbers, which Diane had mentioned earlier, some of the numbers, you turn yourself into a pin cushion almost instantly.
I'd like to.
Jeff's just going crazy
Yes.
on the chat. He's got a ton
Yes.
of questions.
So-
Read the question so the viewers know what the
Here's the
question
one
is.
that I think is really super important: are there any statistics that show actual reduction in Cowlitz County in the reduction of communicable or transmitted infectious or disease for the past 2 years? Is the exchange proven reduction of disease harm? So is that kind of what's on this sheet right here?
No.
Okay. All right.
So the statistics on communicable disease incidents actually come from the State Department of Health, and they're about 2 years behind real time.
Fantastic.
I am happy to go out after this program and research and get back to Jeff with the most current data I can find on communicable diseases. I don't know that you could actually make a direct correlation because there's so many factors in reduction of communicable diseases that it's all attributable to this program.
That actually goes to a point of, there of course will be people in our viewing audience that will go, why would you give a device for somebody who's partaking in a illegal activity? Like, why would you do that? So what are the perceived benefits behind a needle exchange program?
So if people are sharing dirty needles and one of them has HIV,
Mm-hmm.
their buddy is more likely to get HIV. Hepatitis C is nationwide a huge problem. And it's not all attributable to people using drugs IV.
Sure.
You know. And now there's a cure for hepatitis C. It's very expensive. There's not a cure for HIV. Well, I guess there might be a cure for HIV. Also very expensive. The more you can prevent, the less you're spending on that health care. In terms of curing hepatitis C, if we can get folks that are using syringes to inject drugs not to do that and in recovery, then we're probably not going to be treating their hep C over and over and over again.
Mm-hmm.
And I do want to go on record personally, and I think as Family Health Center's philosophy, we are not in favor of any safe injection sites.
The
no
question,
way, no.
The question was asked is if they, if the Family Health Center was a supporter of safe injection sites of any sort, and so now we have answered that. That is a no. How about mobile ones? We're starting to see in Seattle.
What?
Yeah, in Seattle, they actually have mobile things that are actually driving around in the streets, and they pull over and they open up to let people shoot up, and that's kind of a new thing that's going on up there. If there's a group out there called Seattle Looks Like Shit, but it does a lot of tracking of what's going on up there. And that is one of the things that they're really not happy with right now is they've got these mobile vans going around. And
you know, I can see mobile food carts, mobile coffee stands. I'm just,
I mean, I understand the thinking behind that, but I mean,
I want to take a little bit of a dive into the corrective programs themselves. So if somebody's out there watching today, and maybe they're one of the people that comes in on a needle exchange program, and you may have visited with this person before, but for the benefit of our viewers, could you describe the program that once somebody says, you know what, I need to fix what's going on in my life, where do they kind of go from there, and what's the program that you're putting them into?
Well, we walk them upstairs because that's where our outpatient substance use disorder program is. They get FaceTime with a chemical dependency professional, and they get scheduled for an intake appointment.
See, Kevin, they don't even get to leave the property. They just go right upstairs.
If what they're interested in is medication-assisted treatment, we pick up the phone, we call over to our 14th Avenue clinic where we have a prescriber and nurses that do that intake and get them a walk-in time.
Mm-hmm. Nice.
We try to make it easy. If they don't want to go to us, we tell them about the tribe, the other programs around where they can access services.
Now, do you guys have actual beds? And does the Family Health Center have beds for recovery folks?
Yes, we do.
So, because I know that Columbia Mental Health?
Yeah, Columbia Wellness has a detox.
They're opening up a detox, and are you guys going to be working with them?
We are.
Good.
Kyle, bring up the website for Family Health Center if you would. Put it up on the back screen here. Which one of these tabs would somebody go to if they're online looking? Which one of these tabs would they go to? Is it this one here?
IVDU harm reduction program.
I think another.
And then substance use disorder treatment talks about all of them.
Okay.
Those
Kevin, I think another. Oh, we just left the page I wanted. Can you go back one? Can you take us back to that last page with all the numbers on it? Because there's another number on there that needs to be pointed out because that's a good on you guys. Is right there. What is it? Halfway down the list. Overdose deaths averted. 100. That's 100 people who are alive right now because you guys gave them the proper stuff to help care for themselves. Thank you.
Hey, I'm,
So,
I'm,
I mean,
I'm
that's-
curious. So let's go back to another component. Then we were talking about the care programs, and Kyle, go ahead and put the website up there for people, and show those 2 links. So it's the first 2 that show up on the left side of the screen there. How many people have you guys track that statistic? Like how many people say, "Hey, I'm next. Put me into treatment." Do you know how many have done? How many did that in 2018?
Yes. So in 2018, we had, and these are all essentially self-reported to us, or we walk them upstairs. So we had 46 people go into detox.
Mm-hmm.
We had 39 people go into inpatient treatment. 63 people went into outpatient treatment. 96 people started using methadone.
Mm-hmm.
And 134 did buprenorphine or Suboxone.
That's
So-
a lot of people.
It is a lot of people.
Yeah. What does that number come up to? That's a lot of people. And here, in your first statistic, actually, because I remember being at a couple of these meetings where the county was talking about people that actually went into treatment, and I could be wrong. You guys can feel free to correct me, but I was hearing numbers like 7 or 8.
Yeah, it was real low.
It was real low.
So you just threw some numbers out in different categories there, and it's a
that's
couple hundred people.
Yes.
But it's not, these are not an unduplicated number, because many of our folks that are in inpatient treatment
Mhm.
also are on Suboxone or methadone.
Gotcha. So
Yeah.
some of it could be
Yeah.
duplicated.
Yes.
Yeah.
But the number, like the Suboxone number of 134,
Mm-hmm.
is not duplicated. So
Gotcha.
those are individuals in each of those, but they could be in a number of the categories.
So even the treatment options have increased by 10, 20 times, maybe beyond.
Yes.
So so just talking about Suboxone,
Mm-hmm.
there's like 3 or 4 different flavors here just in Cowlitz County.
Mm-hmm.
So like with Kelso Treatment Solutions, they have daily dosing where you go in and they give you your Suboxone for that day.
Mm-hmm.
And then there's Metrics where you go in and you get a script from the telemedicine. And then what Family Health Center does is ours is primary care based,
Mm-hmm.
so that patients can actually decide whether or not they want to do outpatient treatment or inpatient treatment at the time. But getting them on Suboxone is essentially where they're able to maintain a normal, sober life
Mm-hmm.
and be able to start contributing to their own welfare and perhaps their family and their community.
Mm-hmm.
So it really has changed a lot over the last couple of years here.
Mm-hmm. One of the things that's like really helpful for somebody who's in a situation like that, because life isn't good for an addict in any way, shape, or form. And a lot of them don't, will admit to things being bad in their life, but not necessarily see like what that path is and what the future could look like if they select something new. And there's an equation on the board actually here behind me, D times V plus F have to exceed R. And this actually applies to absolutely everything in life. So the score on the math equation, so D, V, and F all get a score of 10, and the math has to exceed whatever somebody's resistance is to doing something different. And one of the things that I would be more than happy to offer for you guys on us would be if you were interested, and we could do this in a way that protects client confidentiality and all that kind of good stuff, because obviously we wouldn't want to venture into that. But we would be more than happy to offer you video support to create a video that says the how-to, outlines that first steps, helps somebody be able to find this is how easy it is, you guys. And maybe some of the people who are even on the staff that you say were prior addicts and they got into the program, we'd be happy to help you produce that video content, because I know how critical the first steps really are. Somebody has to understand how bad life actually is. They have to be able to understand what life could look like if they make a change. And then they need to know that those first steps are actually much easier than they think. Because it's intimidating and it's scary, and I sit across the desk sometimes from a business owner who's looking at his profit and loss statement and going, does it say anything bad? And you're going, and this isn't even addiction or any, people are always scared of this so-called unknown, and we'd be happy to help introduce that via video and make those first steps real
Great.
clear.
We'd appreciate your help.
Yeah.
I have more questions on numbers and stuff like that.
Go ahead.
too, so
I'd really like to address Jeff's next question.
Yeah, let me do this real quick because this kind of
Okay.
goes along with that.
All right.
I'm seeing guys is on your list there that you guys are giving out Narcan, quite a bit of it. And is that, can anybody come in and get that? Because, I mean, if you have Narcan in your car, you guys, or you have it on your person, you have the ability to save a life. Is that something that anybody can come in and get? Or is that, I mean...
So that's kind of a loaded question.
Yeah, okay.
They cannot do it at the harm reduction program, the needle exchange, unless they or a family member is an IV drug user.
However, we have a deal.
In our because that's mainly because the naloxone at that program is supplied by the University of Washington specifically for needle exchanges and needle exchange users.
Well, I know the sheriff's department is rolling around with it in their cars now, and
Yeah.
I know a lot of the police are, and it makes a huge difference. I mean, but you were asked a question, and we can go to that because it does fit into this. It says, Jeff Wilson is asking, can you reverse an overdose from a fentanyl injection?
Yes. It takes a hell of a lot because fentanyl is so strong. But we also, not only the needle exchange program, all of our primary care clinics all have naloxone as well that's available to our patients, and we would make it available to people in the community as well.
Good. I think it's important too because
We have done the training and supplied naloxone to a number of social service agencies that work with high-risk populations. So sure, business owners. I know that there's a number of business owners that.
Well, you see the
might be
defibrillators on the
concerned.
walls,
Yeah,
when you go uptown, and you see the needle boxes when you go uptown, and I think it makes sense in certain areas of town where you have more drug use. It would be smart to put, emergency Narcan there for them as well. But some people would probably fight against that because they'll call it catering to the folks. But you're just trying to save lives.
If people are interested in getting naloxone to have in case they come across somebody that's overdosing, we're more than happy to run through. It's a real brief training and provide them with.
So we could do a training video on that with them too. I mean, there's all kinds of things. So.
Kyle, scroll down on this list. Did you capture the bottom piece there? I just ran the math on this, and you mentioned that some of the numbers are duplicated there because of somebody might be in detox and using Suboxone at the same time. Is that correct? But our total numbers here on this list down here, you guys, are 378. Like I said, those conversations that were held in the commissioners' chambers, I remember that question being asked, and somebody scrambling for paperwork to look at to see who was actually in the program, and I remember the number 7 or 8 mentioned.
Yeah,
and I was like, wow. If you're going to defend what you're doing and showing that it's effective, you need numbers more like this.
Well, and those numbers are still lower than what I would like to see.
Excellent.
But they're way higher than we predicted when we started because of the history with public health running it. We weren't sure how effective we would be in getting people into treatment. So, I mean, it is great, and it's really a testament to the staff who work at the needle exchange in helping guide people into those opportunities.
It looks like you guys are doing other things to help folks out too when they come in, like wound care, HIV tests, pregnancy tests, all kinds of stuff like that too as well. So, is there any other numbers or anything here on here, you guys, that you wanted to get out? I mean, because we haven't even touched this stuff here at all. And
Kyle, you have those slides?
Yeah,
the pie charts?
do have those up there.
Pop those up there and let's go through those real quick for the benefit of our
because
viewers.
there's some interesting things on here, and I told you before the thing that I was going through the numbers, and I saw the amount of students on the list was extremely high. Not grade school students, you guys, but people who are out of high school and college students and stuff like that. And I was curious on I wonder why. And I know you guys probably don't have an answer to that, but
I don't have an answer to that, but I think it's very interesting, and it probably does point out
get that
the
page up there.
opportunity to maybe partner with LCC and do some education on their campus.
Yeah.
Not to do the syringe exchange on their campus,
Right.
but to do more education and
You want to throw
reach
this?
out more to
You
the
want him to throw
community.
this up on the screen, right?
Yeah. Yeah, any other slides that are there data-wise that we have in the background, pop those up there.
So, and I see Jeff has another question related to what are we doing to inform our community about the dangers of fentanyl?
Yeah, fentanyl's the new drug that's coming. And
Yeah.
and
No,
everybody's-
it's not coming. It's here.
Oh,
It's here.
Okay.
Yeah. You know, we have not done much in that arena, and I think there does need to be a lot more done, because this is something that not only affects the folks that might be injecting, but it affects anybody who might find a used syringe,
Well, we
as well
yeah.
as.
I don't know if you
yeah.
remember. I think last year or the year before, there was. I can't remember whether the officer died or he had to go to the hospital from just getting a little speck of it on him
yeah.
during an arrest. And so it's.
I believe he did live.
Yeah,
Yeah.
he did live.
But he did end up in the hospital for a number of days.
So I mean, this is how dangerous this stuff is. I mean, just a little bit of it can really mess you up.
Kyle, bring the slide up on homeless status. Just get that one up on the back screen. I want to take a look at this. So what are we seeing here on this chart?
That
So these are the number of, the blue part of the pie chart is a number of people who have come to the needle exchange program who are not homeless.
That's correct.
Okay?
which is a very large number, by the way.
Yes.
55% of the people using are not homeless.
That's actually kind of a significant thing to understand, because a lot of people just assume that if somebody is a addict, drug user, that they're likely also a homeless person too.
That's not necessarily the case. You know, there is a higher incidence of substance use, abuse, and mental illness in the homeless population, but not every homeless person is homeless because they're an addict or mentally ill. Many of them are homeless because something happened in their life, like a major medical event or something, and losing their jobs, and they ran out of money, and they were forced out onto the street or into their cars or to couch surfing.
Could be a loss of job, could be divorce, could be all kinds of.
Yeah.
Somebody was on an adjustable rate mortgage and went from 5% to 10%, and all of a sudden can't afford the house payment. Yeah, a lot of things.
A lot of things can happen.
Contribute to that. Okay, health insurance status. Bring that one up as well. So this next slide is the number of people who actually have some form of health insurance. So what was the percentage? That's actually almost 75%.
Right. So this actually, we do have navigators who help people sign up for health insurance. So part of what we do at the program is offer that assistance if people are uninsured. And just to be clear, Family Health Center does not turn anybody away because they don't have insurance.
Right.
And then the sources of medical care. Put that slide up
Yeah,
there.
your organization is here to help the community.
Right.
So these are the different forms you have down in the lower slides: emergency room, outpatient clinic, jail, hospital. So these are the sources that people are coming from into the needle exchange program?
No, it's where they say they're getting their medical care.
Gotcha.
So what's pretty striking is the 31% that aren't getting any medical care at all.
Yeah, very interesting.
And then the next highest number there is the emergency room, which is the absolute worst place to go for routine medical care.
Most expensive.
Most expensive.
Yes.
So again, an opportunity for us to improve those numbers as we continue to work with the folks that come in for care.
Which one of these areas would you like to see increase in terms of medical care?
Outpatient clinic.
Okay. All right, very good. Well, maybe maybe down the road when we have conversation again and we can look at the 2019 numbers, maybe that will have happened. Anything you guys want to share with our viewing audience before we
just that you're doing just a way better job than, I mean, there's a lot of people out there that didn't think you guys are going to be able to do it, and so I'm glad to see that you guys are doing it, and if you guys have made an improvement, and that is what the citizens were looking for, was an improvement in the program, showing that it is actually working, showing that that things are going. The numbers that we were getting before, they weren't. I mean, it was difficult getting those numbers. But so thank you guys for helping fix this problem, or at least making it better for now.
So I do want to invite the citizens and the public, that anybody that might have suggestions for how we can improve this program or any services that we offer, please, reach out. There's a contact us place on our webpage. Those emails all come to me. I respond to them. Give me a phone call. 636-3892.
All right, so for anybody...
walk in the door. I'm a friendly person.
Yeah.
And you guys have locations all over the county, too, don't you?
We do.
Not just here in Kelso and Longview. I believe you guys...
Castle Rock and Woodland. We have a clinic in Cathlamet and another one down at Ocean Park.
All right, Kyle, if you would put the website back on the back screen for the benefit of our viewers. You can go to the website, collettsfamilyhealth.org, to get more information. If you're seeking treatment options for yourself, those are also available there. If you scroll down just a little bit, Kyle, you'll see those on that page. Places for you to go if you're looking for help and taking that corrective action. You can also call Family Health Center 636-3892. That, of course, is the 360 area code, 636-3892. Kyle, if you would as well, put that in the stream for the benefit of our viewers. Well, thanks to Dian Cooper and Jim Coffey for joining us here to talk about Family Health Center and the update on the needle exchange program. The information, as Chris already says, shows a dramatic improvement. And as you mentioned, Jim, even beyond your expectations. But it's fantastic. I've heard a lot less about this whole program. It's almost like it disappeared, kind of.
Well, that's
and that's the good news.
That's the good news.
That's the good news.
Yeah.
So I would like to just make one last, a couple of comments. One is it really is all based on our staff that are there, who actually really do care very much about the clients, and they really care about getting people into treatment. The piece I think I'm most proud of is that the state of Washington is looking at us as a model program for the entire state, and are trying to replicate what we do here
it's about time.
at the other syringe exchange programs.
Cowlitz County is leading the way.
It's usually Seattle sending it to us and saying, this is how you do it, and they're a disaster up there, so it's good to hear that they're coming.
Well, that's why I asked you if you had a chance to visit any of the other county programs, because I've seen some videos produced by them, and I didn't see how it was any different than what Cowlitz County was doing. And so, I hope the state will learn something from what you guys have done with that, and you deserve some huge kudos for what you've done. So again, for folks, go to the website. It is collettsfamilyhealth.org, and that is in the stream for everyone. A special thanks to Dian Cooper and Jim Coffey for joining us here on the broadcast today. I'm Kevin Hunter, and Chris Bornstead, Kyle Torgerson, sitting off screen and making all the tech happen here today. All right, Kyle, take us out of here.
This concludes today's live programming on Northwest Digital News. Thanks for joining us for this special broadcast. Heard around the world in more than 70 countries on YouTube, Instagram, Patreon, Facebook, and Twitch TV. If you enjoyed a story or guest we had here on Northwest Digital News and would like to strut your stuff on the broadcast, email us today at wainfo2017@gmail.com or call or text to 360-545-3501. We're always interested in unique stories, topics, and guests to share with our worldwide audience. Before you go, don't forget to give us a big thumbs up and comment on the live stream. And for those of you who'd like to financially support the broadcast, you can do so at patreon.com/Northwest Digital News. We thank you for your patronage. On behalf of Chris Bornstead, Kyle Torgeson, Stephanie Hunter, and all the people that made this broadcast possible, I'm Kevin Hunter. Till next time, take care.